only 15% of Kenyans in the informal sector have access to the National Health Insurance Fund, leaving majority of Kenyans paying out of pocket. And what we're seeing here, basically patients are dying prematurely or simply going broke.
Again, access and cost are an issue in Kenya and throughout Africa, as well as, even here in the US, 30 million Americans lack access to health insurance. So the big question that everybody's trying to address is what are new ways to finance and deliver care?
Finding the right accelerator is very key for any entrepreneur. I will highly recommend for any entrepreneur on the continent to join FAST Accelerator. It's a very intense, very fast-paced, program, but the outcomes you get to see them quickly. My name is Edwin, with the background in telecommunications, and I'm the CTO of Snark Health. So a little bit of what we are building, we are addressing two things, cost and accessibility. And just to give an overview of how we started, I've known Hank for the last 24 years. I met Hank first time in 1998 when he traveled to Kenya to do a volunteer program. And since then, he built a sustainable organization with my dad. And they were focused on 4 pillars. That's healthcare, HIV/AIDS, education, and micro-enterprise development. So fast forward a few years later, after I finished my university in Italy, I moved to London. I'm also second-time founder. So my first startup is based in London, focused on portable power network. And then when traveled back to Kenya, we started thinking about what else can we do leveraging on technology in the healthcare space. So that's how SnarkHealth was born. And now we're building SnarkHealth.
Okay, interesting. I'd also like to hear from Hank's perspective what his story is and how SnarkHealth came about, basically.
As Edwin talked about, I was first in Kenya back in 1998 and started working with Edwin's dad on, we started off with HIV education, then we expanded into healthcare, we built a school, small business development for women, and over the course of the years we've continued to be in touch with both, have a passion for how we can leverage technology to improve access and lower cost of care for patients in Kenya. But the issue of access and cost are not just unique to Kenya. This is a global issue. More than half of the world's populations lacks access to essential health services as well as health insurance. So here in the US, I've served in various leadership roles, and one of the programs that I designed and rolled out was the Medicare bundled payments program for care improvement, where we focused on improving quality and lowering costs from hospital admission to 90 days discharge. So the combination of my experiences in Kenya as well as working as a doc, both the bedside and leadership roles in the US, has led us to where we are today, building Snark Health. Excited to be here.
Okay, great. And I'm very glad to host you guys. I'm going to switch to Edin here. Basically give a brief overview of the company based on the Kenyan ecosystem, how it fits into the industry and the market in general.
Yeah, good question. So first of all, some background information on the situation of the healthcare. Kenya alone, for example, only 15% of Kenyans in the informal sector have access to the National Health Insurance Fund, leaving majority of Kenyans paying out of pocket. And what we're seeing here, basically patients are dying prematurely or simply going broke. So the big question is, whether I don't have insurance or I have insurance, can I still access healthcare and affordable and quality? So this is a serious need, and just to this is something that has been there for so many years. Personally, on a personal level, when I was 11 years old, I was transfused over 100 pints of blood because I suffered from a condition that was almost like plastic anemia. So that means we traveled across the country looking for help. And that time we didn't have any healthcare insurance. So that means my parents had to continue raising money so that we can try to find help. So, and then 24 years later is still the same issue. So, so that means we still have a long way to go, but this is the start. So if we can figure out an alternative payment model and actually help people without health insurance access healthcare, this will be a game changer. So, and how we're doing it, which I'll also let Hank talk about it a bit, but we do it through Hippocratic Coin and our health savings vehicle. And this over time, we're helping patients and doctors also earn money from the platform itself. But how are we doing it? Through de-identification of the data. So that means we de-identify the data and then we'll be able to monetize on this data. And this money will go back to the doctor and the patient who created the data, and it's in their wallet. So they can use it to again pay for healthcare expenses as needed. Yeah.
And just before Hanks answer that question, I'm going to ask a follow-up question here. How would you describe the industry that you are in? Obviously, your solution is partly in health and partly in finance. So maybe you can give a bit of a background on the industry and how you guys are positioned in the industry.
Yeah, definitely. So again, access and cost are an issue in Kenya and throughout Africa, as well as, I mean, even here in the US, 30 million Americans lack access to health insurance. So the big question that everybody's trying to address is what are new ways to finance and deliver care? So current alternative payment models include capitated payment models or bundled payment models. And while those may be a step in the right direction, I think we have to step back and say, okay, are these new models improving access and lowering costs? Possibly, but I mean, at the end of the day, we need to think about things differently and how we can utilize data that's generated through the doctor-patient relationship to help more patients be able to access doctors. So that's a big component. And then using at-risk contracting, so building on my experiences. If a patient's not able to pay for consultation, then it either doesn't happen or they have to go into debt to try to get healthcare services. So patients have a choice. They can choose to pay the consult fee or not. Doctors have a choice. Doctors on our platform can say, you know what, I'll provide the service at a cost of zero because I want to serve patients. And if doctors make that choice, then they retain a majority of the earnings from the de-identified data monetization. If a doc says, that sounds interesting, but let me just get my standard rate, then that kicks down to us, Snark Health as an organization, and we step in as a payer. And the doc gets paid, the patient gets access to the service that they otherwise wouldn't have access to because of cost. And then we are the payer, and in exchange for us assuming that risk, then we earn the majority of the upside of the de-identified data monetization revenue.
So the company, what you're approaching, your approach to the solution is very, very unique. It's hardly been done in a very complicated scenario. Just maybe to expound more on the solution here, I'm going to base, maybe you can base your answers, on UN SDG goals.
Yes. So we're positioned to tackle this DG3 by UN, which is good health and well-being for all. So that means at all stages, so from infant all the way how are we making sure that the population is healthy. And of course, when we talk about healthy, so sometimes look at it, is it preventive healthcare, or is it after? Do I go to hospital when I'm actually ill, or can I take care of myself before I become sick? So that's how we're positioning ourselves to ensure that you don't need to get sick to see a doctor. You can still talk to a doctor and find out, address any question.
Right, great. So I have to point out that Snark Health has a very unique solution, which is in between two different industries. So obviously, you are facing very unique challenges, which means you are going to face different challenges. You're going to have different solutions. What is your key takeaway for other startups who join the accelerator? What would you advise them to do?
Yeah. Again, as mentioned, finding the right accelerator is very important, and not just to say the least. But first is I will highly recommend for any entrepreneur on the continent to join FAST Accelerator. It's a very intense, very fast-paced, program, but the outcomes you get to see them quickly. During our program, we managed even to launch our Android app just within that time frame, and which has been successful so far with over 1,000 plus downloads, both for the doctor and patient app. So, and again, as always take that leap of faith. Don't overthink, just do it. Just do it, and don't be scared to make mistakes, because that's how you learn. And also don't be scared about the no's. By the time you get the 1 yes, you might have to bring at least 99 no's. So if you haven't got a 99 no's, just keep going.
Okay.
Yeah.
All right. So between the two of you, there's a lot of experience coming from two different industries, and your company has to work with very many other practitioners, so many other parties. So my question here is going to be, does your product or service provide solution to SMEs? Besides
Yes.
the individual contractors like social workers?
Yes.
Does it partner with SMEs, and how does that look like? And maybe Hanky, we should add to what Edwin says.
Yes. So quickly, again, our journey is end to end. So the moment you pick the phone call, you want to consult a doctor, that's the telemedicine part, which is exciting and everyone is doing it. But of course, as we are trying to figure out all the way to the end in terms of cost. So once you pick the call, first step, you'll talk to a doctor virtually. If your issue still you need a continued evaluation, what means is you move to step 2, and SnarkHealth will refer you to our narrow networks. So these narrow networks, this is where now the SMEs come in. We have guys who have private clinics, dispensaries, or even bigger hospitals who still want to increase a little bit of their revenue. So you can imagine millions accessing our platform. The patients will be referred to these small clinics, and then that way, we're empowering them. We're giving them more. It's a profitable business for everyone who's plugged into this. And maybe Hank, you can add on narrow networks.
This is another piece of the platform. So in Kenya, as well as the U.S. and globally, healthcare is fragmented from a access point, from a pricing transparency point, from pricing in general. So we know that narrow networks work because you identify partners that are aligned and say, you know what, we want to serve your patients if they have diagnostic needs, if they have therapeutic needs, and in exchange for volumes, we're going to offer your patients a discount. So it's a win-win for everybody. Yes, there will be some consolidation, as that's the natural sequence of events, but at the end of the day, if there are people in the healthcare delivery chain that are overcharging or not providing good services, this allows, again, the patient to be at the forefront of the delivery and financing of healthcare, and that's where it really should be. then there's also opportunity for business intelligence solutions, so the businesses can predict and optimize their operations. So not only more serving more patients, but also visibility into supply chain and being able to predict and forecast their needs, and from products, but also from a staffing perspective.
All right, and basically your solution, the way it's poised, so you're trying to tackle challenges from multiple avenues in different sectors, with very many different practitioners in the field. Myself and the company Flapmax came to work with you through the FAST experience. So maybe we should start with that. How did you come to know about the FAST experience, and what is the general feeling about the acceptance, the expectations, the experience?
Yeah, very exciting. So first of all, I learned about Flapmax during the call for applications. I found it actually online, to be honest. I was searching for, I was just looking around the African ecosystem, accelerators, what are they doing in healthcare, especially, because very little is done in healthcare. So I wanted to figure out who else, who are trying to support businesses or entrepreneurs in healthcare. And Flapmax, when I saw the call, I jumped on it, we applied, and we were so excited when we found out that we are selected among over 800 plus applications across Africa. So that's something special. But then what's also more crucial to understanding the whole thing, the right accelerator, finding the right accelerator is very key for and for any entrepreneur. Some accelerators kind of know what they're doing, but then they also end up wasting entrepreneurs' time. Instead of focusing on businesses, you're taken through some sort of coursework, trainings that don't really lead you anywhere. So FAST has really been great, amazing to us. And more importantly, the mentor network. FAST team, you guys did your assignment. You brought in very serious industry guys who really, helped us fine tune our business model and just go down to what's important. Then also beyond just the mentorship, there's that promise, which we are lifelong partners. So that means you didn't leave us just hanging after demo day. That means you'll continue supporting us. And that's very valuable. It's something that, we can't take it for granted.
Okay, great. Yes, and I'm also looking forward to partner with you in the future. And speaking of working together, one of the big moves that you guys have worked on is the migration to Microsoft Azure Cloud, which I have to say you guys managed internally very successfully, which speaks volumes about your internal dev team. So with the migration, how has the experience been in general?
Yeah, again, Flapmax, you ensured that, you didn't want to assume that each startup has an idea of, the platform, how it works. So we just, hey, these are cloud credits, have fun. You actually took us again to another mini quick training just to ensure that we understand what's at stake. So after the training, we had to go through technical discussions, and as much as some of the things we knew internally, how to navigate around the platform, but then the migration was quite easy. It took us, I think, under 3 days, we were done moving all our infrastructure to Microsoft. And then also the response time from Microsoft team, very good. And we're consuming credits more than we even anticipated. So maybe it's a good thing.
It is a good thing. I think the business side of using credits means that you guys are active, you're busy, which is a good thing. And also, one of the main features that you guys will be working on is AI, or at least you're working on at the moment.
Yes.
So moving forward, we're going to do the proof of concept. Yes. But so far, with the interaction from interns from University of Florida, yes. What is your feedback so far?
Good. Yeah, amazing. So again, earlier discussion, we said how we want to use the AI for predictive analysis, and that will help us determine also pricing and, a few things. For example, at what point will the patient pay the consultation fee? At what point will the patient decide, I want to take part of data monetization? All these are AI, and it has to be modeled appropriately. And the interns have been very valuable. They came on board, and we shared with them our problem statement. They digested the concept very quickly, and as we speak, we are waiting now to look at also the code, how far they've gone. But it has all been positive experience so far.
Right.
Yeah.
And maybe I'm also going to ask Hank here. I like the fact that the interns are matching the energy, the synergy within the company, the teamwork. What do you think about the cooperation between US and Kenya, between these two different companies in achieving AI solutions?
Yeah, I think that there's a tremendous opportunity here. I tend to think about AI in terms of from an operational perspective as well as a clinical perspective. I know that there are specific use cases from a clinical perspective with AI, and there's definitely potential there. From our perspective, we're looking at how can we leverage AI to improve operations and lower the burden on docs and nurses at bedside, because as technology advances and the delivery of care changes, people are spending more and more time away from patients as opposed to with patients, listening, talking, coming up with plans, education. And so we're viewing our approach to utilization of AI is from an operational perspective initially, so we can give doctors and nurses more time at the bedside to really deliver the positive impact that they've spent their lives learning and doing. So we're excited about the future.
I'm going to ask Hank. Obviously, you have a great co-founder here in Kenya. He's been doing a very good job, but you've had to set up a company remotely. You have remote workers, you have remote partners. So while working with in the general ecosystem, what would be advice to founders and co-founders and even developers because they are in the ecosystem?
I would say find something that you think that you could do better, something that in your day-to-day life, whether at work, professionally, or sometimes personally, but people that experience the systems over and over, years after years, decades after decades, these are the people that we need to be encouraging to lead with new solutions. The folks on the ground in the trenches are the ones that identify the opportunities for improvement and where we can do better. So I think if anybody has ideas, one, identify what would make their daily lives better, and then two, have the persistence to see it through. It's not easy all the time, but having the conviction that what you're doing is worthwhile and worthy of spending the time on, and hit the ground running, be comfortable with what you don't know, and then figure it out. That's what we've been doing for a couple decades now.
Let me talk about our current traction. And after we shipped the Android app, the number of patients onboarded also increased. So we're talking about at least 4,000 patients on the platform, 305 combination of clinic officers, nurses, pharmacists, doctors on the platform. And our community health workers, we're about 55. And then we also have a virtual health community, which we didn't mention earlier on, but virtual health community basically means it's a group of patients, doctors, public officers, community health workers, and the population in specific areas. So we launched one in Bungoma, and it's there. So what a virtual health community means is the community is taking their healthcare issues themselves head on. So because SnarkHealth can't guess everything that's going on in communities. So their community, they'll say, apart from these, we also need these. These are the type of diseases. So with that reporting, it informs SnarkHealth to start improving the platform, adding more features and so on. And that's one way of also, decentralizing healthcare and making it accessible to everyone. So for the traction bit, that's ongoing. And of course, marketing, we're doing one-on-one discussions with doctors, because that's very important for them to understand how the platform works and not sell ourselves as a telehealth tech company. And then for patients, we're growing with community health workers, and of course, social media is also helping us to scale.
From a traction perspective, there are different approaches on go-to-market. Some digital health companies will go straight to patients because it's harder to convince doctors and healthcare workers that what they're building is something new that's actually going to be useful to the doc at the bedside. So again, tremendous interest and tremendous potential for digital health solutions, but at the end of the day, many aren't built with the doctor, clinical officer, nurse in mind. And again, there's nothing wrong with that approach. It's just different. I know for me personally, as a doc, you get bombarded with new ideas that are going to change everything, and yeah, maybe, but the solutions need to be built by the people that are in the trenches day after day taking care of patients. So that's been our focus, is to talking to docs, clinical officers, nurses, community health workers, the people that are at the core of the healthcare system, and listening to them, meeting their needs, because when you serve the people that are delivering the care and make their lives better, they're going to be able to in turn serve more patients, deliver higher quality care, a better patient experience. So that's been our approach.
Okay. And maybe before I switch to Edwin back, what would you describe as your big breakthrough as far as Snark Health goes?
We're building a new way to pay for healthcare. I think that sums it up in a simple one-liner. Currently, you can pay for healthcare with insurance, which, as Edwin talked about earlier, about 15% of Kenyans have health insurance. So for the remaining 85%, they're left with cash. Getting healthcare is not cheap. So these folks either don't get the care they need, or they go broke, or they die earlier. So creating a new way to get people the care they need when they need it is important. And at this point, I'm not seeing anybody else out there trying something new. So that's what we're excited about.
Yeah, and also we've gotten some bit of partnerships going. So we have an organization. It's actually, they're also targeting a lot of SMEs in Africa to help SMEs access capital at a almost very tiny interest. So we talk to them because we also understand healthcare practitioners. They also need just slightly more capital to continue running their clinics, their places of practice. So we would like our members, people using our platform, to tap also into this opportunity so that they can fund their practice day to day. Okay. So that's one partnership that's ongoing, and I think that's also going to be a game changer.
Okay, so let's speak about the bigger region, so Africa. So we've spoken about the FAST Accelerator in partnership with Snark Health. We've also spoken about Snark Health as a solution. Let's talk a bit about the startup ecosystem in the country, in the region. What are your thoughts so far as a player?
Yeah. One thing that I continue seeing and I appreciate is Nairobi. First of all, it's one of the destination. Silicon Savannah that was coined, but still, I feel the energy here. People are building products, and it's really going very fast. So in East Africa, I would say Nairobi is positioned well. Actually, Kenya is positioned well in terms of startups and growth. Of course, South Africa has a little bit of higher traction. So there's that, which is a very encouraging thing to see. But then also there are also other challenges in the ecosystem that, of course, you can spend the whole day talking about it. But what's important for me would be if governments could create more policies around supporting entrepreneurs. So instead of saying hard landing, we start saying soft landing, and then yeah.
All right, great. I'm going to ask Hank this question, maybe because you've already had a bit of a background of Edwin. As we wrap up, what motivates you to do your daily tasks, especially running a startup in such a challenging ecosystem?
That's a good question, and it boils down to when I get up every day, think about what am I going to do with my day and time. And I've been working as a doctor for the past 17 years, and I've in the US as well as Kenya, and when you see that there's a better way to do things, but yet there are barriers to implementing a new way of doing things for multiple reasons, it's not easy to make change. It takes persistence combined with the understanding of the current state and how we got here in terms of the financing and delivery of care in Kenya as well as in the US. And so having a deep understanding of all the different components of paying for and delivering healthcare, combined with the, I'd say, we'll just call it frustrations with the current system. So you combine those two and see a way to do things better, and then we just keep pushing forward. So one step after the other, and we get there.
All right, yes, you will. I'm going to ask Edwin the very last question here. Where do you hope to see yourself in 3 to 5 years with your business?
Yeah, good question. So in terms of just some numbers, we're targeting at least to serve over 700,000 patients onboarded on our platform. And according to WHO, it's recommended 1 doctor per 1,000 patients. So the goal here is, if we get in 700K, then also you should have at least more than 700 doctors. 7,000 doctors matching to that. And what I'm seeing here is a reality where now people will start accessing healthcare at in affordable ways, because they will have so many ways to access healthcare, whether you have cash or you don't have cash. And also, with the Hippocratic coin and the health savings vehicle, that is going to propel this growth. So this is a disruption, and 3 to 5 years, it's going to come to a reality.
Okay.
Yeah.
All right. So thank you so much. Thank you, Hank, for facilitating this and working with the very challenging time zones, and Edwin as well.
Yeah.
And also thank you for supporting the interns. I've heard of good reviews from the different developers you're working with, from the interns. They're also so happy to working with you guys. I wish you luck, and hopefully you're going to partner in the future. That is all.
Yeah, thank you so much for having us.
Thank you.
Cheers.
Thank you, Hank.